Policies and procedures set out the manner in which a healthcare provider collects, uses, and discloses personal health information. It is critical to an efficient healthcare practice to have written policies and procedures, train new employees, and to make sure that they understand their roles and responsibilities, and we don't have to recreate each of those steps. We know what works and becomes efficient for our practice. Having policies and procedures is also a requirement by legislation, in this case, the Alberta Health Information Act, and by professional college regulations and standards. Everyone in a healthcare practice, including front office staff, wellness practitioners, and custodians, including physicians, must be aware of and follow these policies and procedures. The policy and procedures also become the foundation of your privacy impact assessment. You are listening to Practice Management Nuggets podcasts. Tips to help you start, grow, and improve your healthcare practice and your career. I help you manage the pink elephant in the room. Get the show notes from our website at practicemanagementnuggets.live. So my name is Jean Eaton. I'm your practical privacy coach and your practice management mentor with Information Managers. And I love having you join me on social media, so you can follow us on the podcast at our new podcast homepage, practicemanagementnuggets.live, and on social media for Facebook, Twitter, LinkedIn, and on our YouTube page. Today, we will review a privacy breach investigation report from Alberta's Office of the Information and Privacy Commissioner, the OIPC. This investigation started with an employee suspected of accessing health information for an unauthorized purpose and uncovered that the important policies and procedures were missing. In this clinic, there was a conflict at the clinic between the employees and the employer. An employee, employee A, was on leave from her position at the clinic. Her access to the electronic medical record was suspended at this time. Over the course of 2 months in 2016, employee A and employee B accessed patient records in the EMR using employee B's credentials in the EMR. They used information in the EMR, which included patient information, to support the employee's dispute resolution with management. The employee's access to and use of health information is in contravention of the Health Information Act, Sections 27 and 28. The HIA requires the custodian, the physician in this case, to take reasonable steps to maintain administrative, technical, and physical safeguards to protect health information as required by Section 60 and 63 of the Health Information Act and Section 8 of the Health Information Regulation. In November 2013, the clinic submitted a privacy impact assessment to the Office of the Information and Privacy Commissioner prior to its implementation of an electronic medical record. Now, the PIA included written policies and procedures. The letter to the OIPC that accompanied the PIA was signed by 2 physicians and employee A, who was the privacy officer at the time. The physician named in the investigative report is not the current custodian at the clinic. The custodian was hired in 2015 and was not a member of the clinic in 2013 and was not involved in that initial PIA submission. During the investigation, both employees indicated that the policies and procedures were in a binder in the clinic, but it was never used or shared with the staff. The HIA requires the custodian, the physician, to take reasonable steps to maintain administrative, technical, and physical safeguards to protect health information as required by Section 60 and 63 of the HIA and Section 8 of the Health Information Regulation. Oaths of confidentiality may have been previously signed by the employees, but the documents could not be produced during the investigation. Section 8, sub 6 of the regulation states that a custodian must ensure that its affiliates are aware of and adhere to all the custodian's administrative, technical, and physical safeguards in respect of health information. It is common practice that clinics require employees to sign confidentiality agreements and ensure that they receive privacy awareness training with regular updates. In this investigation, the employees said that they never received privacy awareness training. Further, the employees stated that it was common practice at the clinic for individuals not to log off of their EMR account at the computers at the reception desks. It was also the practice that other employees would access and open sessions to quickly perform a task in the EMR. The investigator concluded that the physician was in contravention of the HIA Section 63, Sub 1, which requires custodians to establish or adopt policies and procedures that would facilitate the implementation of the Act and the regulations. Specific findings were also made. Firstly, the custodian failed to ensure that the clinic employees were made aware of and adhered to the safeguards put in place to protect health information in contradiction of the Section 8, Sub 6 of the regulation. Secondly, the custodian was in contravention of Section 8, Sub 6 of the regulation, which requires the custodians to ensure that their affiliates are aware of and adhere to all the custodian's administrative, technical, and physical safeguards with respect to health information. It is important to note that any collection, use, or disclosure of health information by an affiliate of a custodian is considered to be the collection, use, and disclosure by the custodian. In this way, the custodian is ultimately responsible for the collection, use, and disclosure of information. And in this case, without being able to demonstrate that the employees should have known better because they had an oath of confidentiality, because they had policies and procedures, and because they had privacy awareness training, the custodian could not demonstrate that. Thirdly, the custodian failed to ensure that the employee and the other clinic staff adhere to the technical safeguards as required by Section 60 of the HIA and of the regulations. So, privacy nuggets you need to know. These are the things that we can learn from reviewing the privacy incident report from the Commissioner's Office. Firstly, find and review your policies and procedures. Make sure you review them with all of your staff and your custodians, and make sure that you document that this has been done. Review your privacy awareness training, and again, document that this has been completed. All of your staff, including your custodians, should go through a privacy awareness training program at your clinic or a service that you subcontract to another vendor. The important thing is to make sure that it's been well documented about what was the content in that training and that they completed the training and that they learned something during that training. So having some type of a post-test is a good thing to do. Oath of confidentiality should be signed by all of the clinic staff and the custodians and maintained in a secure location. Review your privacy impact assessment and ensure that all of your custodians have read it and understand it. That means that you need to make sure that when you have a change in custodians, that they also have been given the opportunity to review those policies and procedures and the privacy impact assessment, and you need to document that they have done that. Now, this privacy incident occurred in 2016. The OIPC office did not recommend any additional sanctions against the clinic, the physicians, or the employees. However, this might be different if the same situation occurred today after the amendments of August 2018 to the Health Information Act. These new amendments provide a provision for fines under the Health Information Act ranging from $50,000 to $200,000. You don't want this to happen to you in your healthcare practice. These are easy steps to implement. Make sure that you follow these steps to prevent a privacy breach incident of this nature happening in your organization. If you need more assistance to develop your privacy breach management program in your organization, you can contact me at informationmanagers.ca/step. So that's the number 4-step for the 4-step response plan. I'm excited about this new season, and I'd so appreciate your help to spread the word with your colleagues. First, make sure that you subscribe and add a review on whatever podcast platform that you use. Next, take a screenshot of this episode that you're listening to right now and share it on your Facebook, Twitter, LinkedIn, or your preferred social media channel. Remember to tag me and I will reshare your post. When you share the show, it makes it easier for people just like you and who like what you like to find the show. Until next time, this is Jean Eaton, your practice management mentor and your practical privacy coach.